Hi everyone, I am Dr. Ravina, NHS doctor specialised in women's health, and I'd like to welcome you to this dedicated channel for women's health. We aim to share evidence-based information, to dispel myths and talk about the taboo topics that are too embarrassing to talk about. It is here where you will find all the women's health information that you need. So today we'll be discussing how to wash your vagina. Now what I have found is that not many women can actually identify the key parts of their anatomy. In fact, many women do not know the difference between their vulva and their vagina. So today I'll be discussing various different things. So number one, we'll be discussing the difference between the vulva and the vagina. 2, how to wash your vagina. 3, things to avoid doing down below. Number 4, the key red flags to be aware of so you know when to see your doctor. So before we start, all the information from this video is found in the NICE CKS guidelines, the Royal College of Obstetrics and Gynecology, as well as the NHS website. If you'd like to learn more about women's health, feel free to download our free ebook or listen to us on a podcast at Fertility and Femtech. If you're listening to this as a podcast, feel free to check us out on YouTube at Dr. Ravina. So let's first start with talking about the difference between the vagina and the vulva. So the vagina is a hollow tubular structure that's an internal pelvic organ. We can only see this by using a speculum and looking inside to see the walls of the vagina. The vagina is like a balloon. It can stretch and then it shrinks again. And so if you were to insert anything into the vaginal canal, whether that be a tampon, whether that be a penis during sexual intercourse, or if you're delivering a child, the vaginal canal will then expand. It then has elastic tissue within the walls to allow it to spring back. The vulva is an external pelvic organ, and that is what you see on the outside. So the vulva is made up of the labia majora, the labia minora, the clitoris, the clitoral hood, the Bartholin glands, and on the front is called the MONS pubis, and this is where you may find some hair. So what is the function of the vagina versus the function of the vulva? Well, the vagina is where the penis is inserted during sexual intercourse. It's where sperm is deposited, which then travels up into your womb to fertilize your egg. It's also where we release our period and release any discharge. It also allows us to deliver a baby, and it's the passage that allows our child to come out into the world. The vulva is an external organ, and that helps with protection of the internal organs. So the vulva contains sweat glands, it contains hair. It acts as a barrier to protect our vagina from dirt from the outside world, bacteria, and the vulva also contains glands to allow us to have some secretions and lubrication, which helps during sexual intercourse. Now I'd like to move on to washing the vagina. So now I'd like to move on to washing. You have the vulva and you have the vagina. So which one should you be washing? You should be washing the vulva and not washing the vagina. By washing the vulva, it's like any other part of your body. You should be washing it once a day using gentle, unfragranced soap, and that's on the external surface of the skin. As the vagina is an internal organ, we don't suggest inserting large amounts of fluid, water, soap, or douching inside the vagina, as this can strip the vagina of its natural flora, its natural bacteria, and predispose you to developing some vaginal discharge. I have done a video on vaginal discharge that you can check out, and I've also done a video on your vaginal pH and how to maintain an optimum balance if you want to check that one out too. Now, the reason why it's really important to wash the vulva is because the vulva has hair in it. It has dirt, it has bacteria, and you have sebaceous glands, which means it sweats more. And because you have a combination of all these things, we do need to make sure we wash it properly. The vulva may have blood if you're on your period, it may have discharge, it may even have semen if you've just had sexual intercourse, and it may be sweaty because of your sebaceous glands. So now let's move on to cleaning. Should we be cleaning the vulva? Should we be cleaning the vagina? Or should we be cleaning both? The answer is yes to vulva, no to vagina, no to both. The reason why is because the vagina is actually really clever. It's an organ that has self-cleaning properties because it has secretions, and those secretions allow the vaginal environment to have a harmony of bacteria, yeast, the optimum pH, and the pH in the vagina is usually acidic. The acidic pH protects the vagina from bacteria overgrowth. Now, if we excessively wash the vagina, we then strip the vagina of the perfect balance of flora that is currently in there. That means you may get an overgrowth of fungus or an overgrowth of bacteria that then leads to abnormal vaginal discharge, typically bacterial vaginosis. If you want to know more about this, I've done a video on discharge from down below, which you can check out. Now, let's move on to why you should be washing your vulva. Well, the vulva is like any other part of your body. It should be washed once a day thoroughly with water and soap. The vulva is made up of hair, it has sebaceous glands, so you sweat, and you can generate some dirt in there. It's a place where you may have some blood, you may have vaginal discharge, and you may have had some semen there if you've had some sexual intercourse. And a combination of all these things puts the vulva at risk of irritation, breakdown of the skin, itchiness, and that's why we do really need to wash it very thoroughly and carefully with very good products. Now, the products that you use should be non-fragranced. We do not need your vagina to smell like flowers. So now let's move on to how to wash the vulva. So first of all, you want to use some warm water. This allows the soap to interact with the water and the dirt particles on the surface of the skin, on the mons pubis, within the hair follicles, so that we remove all the dirt. This works better with warm water rather than very hot water or very cold water. Any extreme temperature changes like very hot water can make these conditions worse, which is why you need warm water. As mentioned before, we need unscented soaps. So we don't want anything smelling too fruity or too perfumed, as this can be an irritant to the skin, causing irritant contact dermatitis. And once you've had your shower, it's important to moisturize. So we ideally want unfragranced moisturizers. If you're someone that suffers from eczema or psoriasis or dry skin, you can also use a moisturizer as a soap substitute. And this helps to protect the delicate skin so it doesn't get too dry and break down, leading to further infections. So if you're someone that does suffer from dry skin, talk to your doctor, as you may be recommended have a soap substitute moisturizer as a soap rather than using the normal soap that you use in the rest of your body. When you clean the vulva, you first start by cleaning the mons pubis, which is the fatty part at the front, which is full of hair. You then move down into the labia majora, which are the fat lips down below. You then part the labia majora and clean in the inside of the labia majora, which is the labia minora. And then once you've cleaned that area, you then clean around the area between the vagina and the bottom, and this is your perineum. And then you move around to clean the back passage, just to make sure there's no fecal matter that's still there. Now, once you've had your shower, make sure you always put on clean underwear. I don't know if you ever re-wear dirty underwear, but I suggest you don't do that, purely because you've already got bacteria in old underwear and that can cause irritation down below. You don't need to use any products like vaginal deodorant or vaginal creams. I suggest just stay clear of that unless you've been prescribed it or recommended by your doctor. So we've spoken about a lot in today's video. We've spoken about the vagina versus the vulva. We've spoken about the functions of both, why we need to wash the vulva and not the vagina, and we've also discussed how to go about washing it. Now, the key red flag symptoms that you need to be aware of so that you can notify your doctor are the key messages that I want you to take away from this video or this podcast. So the key symptoms are pain after intercourse or pain during intercourse, pain during urination, as this could indicate a urinary tract infection, any abnormal bleeding and any abnormal discharge. So abnormal bleeding would be bleeding after sexual intercourse or bleeding in between your periods. Any abnormal discharge includes a change in the discharge in terms of the amount, the consistency, the colour, and if it just feels really abnormal for you. And then also looking at the skin below in the vulva, have you noticed that it's very dry, very itchy? Is it sore? Are there any spots and warts on the area, as this could indicate an STI? And also any pain during sexual intercourse. So if you have any of these symptoms, please do talk to your doctor. This video is for information purposes only and not to replace your doctor, so do make sure you consult with your healthcare professional. That concludes today's video. If you found this useful and you've enjoyed this video, please click like and subscribe, and do share it with all your girlfriends so that we can share evidence-based information in the women's health space. Until next time, take care. Bye.